Other classes of drugs include tricyclic antidepressants. So these are amitriptyline and nortriptyline, to name a few. You usually can have some form of assistance with your back pain if everything else has failed. Other classes include opioids. Now, opioids are also known as narcotics or scheduled substances. The prescription of opioids are monitored by a lot of state databases and the DEA, so it's a very serious thing. The problem with opioids is that although they may be effective in the short term, they're not very effective in controlling pain for backs in the long term. And this is not just true for back pain, but also applicable to other types of pain. You really want to limit your time on opioids. Side effects of opioids include sedation, drowsiness, constipation, and respiratory depression. In respiratory depression, your breathing is affected to the point where you have more shallow breaths and more infrequent breaths, which can be a problem for people who have sleep apnea or COPD. Now, I have seen people fall from the excessive sedation and drowsiness that's associated with the opioids, and they come in with hip fractures. Very rare, but can happen, and we have seen it. Tramadol. Tramadol is also an opioid, and I put it in its own class because it's the weakest one and it has less side effects of sedation and constipation. But there are some benefits to using tramadol if all else fails. The other benefit of tramadol is that it's safe for people who have kidney disease and or liver disease. Patients have to be very careful for receiving tramadol if they have seizure disorder, and elderly, if they take too much tramadol, that can cause them to have seizures as well. But small doses are fine. Steroids. So we have systemic steroids and then we have the injections. The systemic steroids, the pills, they can be helpful if nothing else works. And they're more helpful for other types of diseases like autoimmune, but not necessarily for muscle or back pains caused by sprains and spasms. We also have the steroid injections. We call them epidural spinal injections of steroids. And those have shown some benefit, some efficacy in back pain, but you don't want to be receiving steroid injections for more than 6 months. We also have duloxetine, also known as Cymbalta. This has mood disorder properties. It can be used for depression, so that has been known to show some improvement in back pain. We have skeletal muscle relaxants, so think of Flexeril, Carousoprodol, Roboxin. These are associated with sedation and drowsiness as well. They can cause dependence and addiction, so you want to limit those. And then finally, we have intranasal calcitonin, which is a treatment method for patients who have osteoporosis, can be used for the treatment of back pain associated with compression fractures. In our next video, we're going to cover non-medication options that have shown benefit in research about controlling back pain. Until next time.